Hi, I'm Isabella Galichia.
And I'm Dr. Jody Galichia.
And in today's video, we're going to be talking about endocarditis.
Well, the heart is made up of 3 layers of tissue. The endocardium, which we're going to talk about today, is the inner layer. The middle part is called the myocardium. That's where muscle contraction occurs. And then the outer layer is called the epicardium, and that's the surfacing of the heart. Now, inflammation in the inner part of the heart, that endocardial area, is endocarditis. And it can be due to many, many things. Bacteria can get into the bloodstream and cause it. It can occur after surgery of the heart, but it can occur for a lot of other reasons. Drug addicts often get endocarditis. People who get other illnesses, systemic illnesses, may develop endocarditis. And then there is endocarditis, which may be caused by some kinds of underlying illnesses that affect the immune system. So a host of reasons for endocarditis. And of course, heart surgery and some of the other treatments that can occur can result in endocarditis, as well as teeth. Getting dental work can cause endocarditis. So the causes are great, but what it is an infection in the inner lining of the heart, which must be treated. And it must be treated with antibiotics. And the treatment is often long-term. It may take months to treat it. Sometimes people will have a simple surgery and develop inflammation and infection of that endocardium. And that takes a long time to get over.
That's so great to know. So what would be some of the questions that I should ask my doctor if I were diagnosed with endocarditis?
Well, once you were diagnosed, the question would be, how did I get this? And sometimes we don't know the answer. Some infection occurred somewhere in the body, and we just don't know how. But very often we can ascertain what caused the endocarditis. So another question you might ask is, what are the symptoms? Because most people get tired and short of breath, and they can't do the things they were going to do. And without treatment, it gets worse and worse. So if somebody says, geez, I've had this for a while, and now I think I'm worse than I was 3 days ago or a week ago, it can be very chronic. What treatment? Do I get antibiotics? Is there anything else I can take? What did I do to cause this in the first place? And if there's a cause for that, how can I prevent that in the future? And do medications like vitamins and minerals and things like that help bolster my ability to fight this overwhelming infection? Am I at risk for a long-term complication due to this condition? How will follow-up occur? Do I do echocardiograms? Do I see a doctor frequently? And drawing of the blood and measuring the blood to see if there's infection in the blood is the best way we have to see if endocarditis is active or not. And you're talking now about often weeks and sometimes months of treatment, and that is always with the appropriate antibiotic. So you have to measure and see what kind of antibiotic you need. And then lastly, one always asks, do I have an underlying condition that may predispose me to have this again? Or do I have an underlying condition that caused it in the first place? In other words, it wasn't an infection caused by a wound or surgery or dental work. It was due to an autoimmune disorder, for instance. So the cause and the treatment and the follow-up, very, very important questions.
Thank you, doctor, and thank you for watching. Be sure to like and subscribe and visit hearthealthcommunity.com to learn more about endocarditis.